And so you work on KNTV.
We are in the studio of the Liberia Broadcasting System.
My name is Scott Fepedo Kwanse. We're here with the Minister of Information and the Minister of Health to give updates to the speed of the COVID-19. Stay with us. My name is Scott Fepedo Kwanse.
This special interview is being streamed live on KMTV and Spoon TV and relayed on other radio stations in Monrovia and the counties, talking about a Voice of Hope in Meriden County and Radio G in Fishtown, River G County. Minister Nangbe and Minister Jada, I'd like to say good morning and welcome.
Good morning and thanks for the opportunity.
Good morning also.
Minister Nangbe, let's first start with you. We are aware the 7th case of the coronavirus was recorded yesterday afternoon. So as it stands, what's the latest update now?
Well, I'll leave that to Dr. Jalak, who has the information about the current status of our country regarding the coronavirus pandemic. But I just want to say very quickly that our health professionals have been working overtime. When we got to the 7th case, which was a foreign national, an Indian by the name of Rajiv Dao, who was tested positive as the 7th individual, the health team sprung into action and started contact tracing. It is a tedious affair because, you know, in Liberia, our address system is not as it should be, and therefore there are unorthodox methods that are used in tracking contacts. I must say that some of the individuals who came in contact with Mr. Rajiv Dao voluntarily called the health team, and which is a very good responsible behavior from any citizen. And we are continuing to do that based on the information I have from the team. The tracing is the target of persons to be traced has increased. So we're talking about over 100 persons being traced. Already some of them have been identified. I think Dr. Fala told me that today they will be testing about 17 persons who are the primary contacts, and then they will expand that to 35, and that will continue because they want to test everybody who came in contact with these people. So we're working very hard, and the systems are there, but for the systems to work, we all have to work hard and abide by the protocols that we have listed through the Minister of Health's pronouncement about a week ago, for us to maintain social distancing, for us to wash our hands, and to stay home when there's no reason to go out, avoid large crowds, avoid large gatherings, and listen to all of the advice that will come from our health professionals. So I would like to defer now to Dr. Jala for her to give us the latest update. Oh, sorry, I just did the job.
Yeah. Dr. Jala, you can go ahead.
Okay, good morning to all fellow Liberians, foreign nationals that are residing in the Republic of Liberia. This morning, again, we regret to say that we have additional 3 cases. So yesterday we were at 7. This morning we are at 10. The 3 additional cases, 2 of them are related to case 6. I won't be calling people names on the air. We'll just say that the 2 of the cases are lab technicians. One of them is a 41-year-old male from Edinburgh lab, and the second one is a 42-year-old male from Aspen. He also a lab tech. So that tells you that those who are running labs, you have to be careful because you do not know which patient is coming to you. So 2 of the patients were lab techs that were tested, and they have been tested positive. The 3rd individual is a 72-year-old male. He was in ELWA hospital in the isolation ward. After his testing yesterday night, he expired this morning. So this make it 3. Based on those 3 cases, 2 of them have a connection to case 6. We are now tracing all of their contacts. That means when you say all of their contacts, because these were contacts of a case. So that tells you that if you are a contact of a case, please show up either at the testing site at ERWA Junction or call somebody to tell them that yes, I'm a contact of a case. We get the names and we start to track people down in the communities. But sometimes when you get to these communities, people are dodging you. People are taking a relative and running away. Why are you running away? We need to do your tests so that we can find out whether you have been exposed, and if you have been exposed, to find out who you were exposed to. So it's just a contact tracing to put everybody in perspective. The more testing you do from the contacts, there's a possibility that you will find more cases. So that's how you see the number of cases are going up, because we are finding contacts and testing them.
So how many of these 3 cases were already under observation?
The 72-year-old man, he was in the hospital. Okay. So we didn't know about him until they called us. Based on the symptoms that he was presenting in the hospital, they called us and we went and did his test. The other 2 people, we already knew about them. They were not in our possession. We already knew about them. They were on the contact list. So when we tested all of the contacts and they tested positive, then we move in, pick them up, take them to the military hospital, and we contact all of the immediate contact. For example, if you are positive, the immediate contact will be your wife, your children, and then your office mate. So we spread out that way until we can collect all the contacts. And we just want to test them. If you test positive, then we bring you into the place. If you test negative, then we advise you. In fact, as soon as we find out that you are in contact, you go home and we advise you to stay there while we are collecting the testing. Right now, we are putting places together so that when we find out whether you are a contact, then we can bring you to that holding area. So that means we'll be putting a lot of people in holding area. So people just have to prepare themselves, because we're finding lots of resistance when it comes to saying that you're a contact and we need to carry you for testing. Then people started to resist, and we get a lot of they cuss you out, and a lot of things are happening. But we want the people to remain calm. The purpose of testing is to find out whether you are a contact. It's not a death sentence. So please, we want you to listen, and if you are a contact of a contact, just let us know so we can do your test.
Well, you just confirmed the 7th case yesterday, and you deployed contact tracers to start the contact tracing of this foreign national, additional 3 cases. How huge and tedious is that, tracing all of these contacts?
It's a lot, but we have a big team. We have a very large team out there doing the contact tracing. People that have been trained. We got over 200-300 individuals that goes into the community to find the contacts.
You care announcing the names of those communities?
Well, you know, and I know that once we say this community, people will start singling people out.
Okay.
So we try not to cause chaos in every community. Like we say, ERWA hospital. So maybe the person could be in that community. We don't know. We have to find out where did he come from to go to ERWA hospital. So we can't start announcing names and communities, because we already saw in the beginning what happened when people found out that Mr. Blama was from this community. They went and blocked the house. They started to go behind people. So we are trying to be a little bit more unique, but we are still finding the contacts. So if it needs to come, let's say if we don't call your name and you don't come forward, then we'll call your name. But in the beginning, if people are cooperating with us and giving us their contact, then we don't need to call their name. But so far, all of the people are cooperating very well with us. They are giving us names of contacts and the contacts of contacts. So we have a good lists that have been generated so far.
Okay. Minister Nangbe, just the other day when we confirmed the 6th case, I was asking if government is thinking, because you come from the national government, the political will there, do we have, are you thinking about, tackling the grip on some of the measures already instituted?
Well, under the health emergency that was declared by the Minister of Health in keeping with the public health law, for now there is sufficient power that she has. But every day the President convenes a meeting of the Special Presidential Advisory Committee on Corona. We review all of the information available. We speak to all of the experts. We speak to the Minister of Health, to the head of the Public Health Institute. We speak to the logisticians. So every day we review the situation, and once there is a determination that there is need for further action based on the evidence that we have and on the need and on the advice of the professionals, Mr. President will not hesitate to institute those measures. So the situation is under review, and we want to take the measures that will be most effective in containing the spread, not to take measures that are arbitrary and that are not well thought out.
Like what are those measures?
No, for now, what had happened was that we declared a health emergency. That was the first step based on the requirements that existed at the time. So the Minister of Health, in keeping with the public health law, declared a health emergency and put into place measures. These measures need to be followed and enforced. There are people still converging in large groups. There are people still not washing their hands. There are people who are still violating all of the protocols that the minister outlined in her statement. So we should focus on enforcing those and on creating more awareness, because once people comprehend the severity of what we are faced with, one will anticipate that they will cooperate more. But like I said, the situation is under review daily, in fact sometimes twice or thrice daily. The President convenes all of the moving parts in this matter, and then if we make any determination that there is need for additional action, there will be no hesitation in proceeding with those.
Minister Nangbe is saying, in short, that they will need the expert advice before any action, further action. When you analyze the data, when you analyze the histories of these cases, is it related to behavioral non-compliance?
Well, we won't say it's related directly to behavioral non-compliance, but you have to take advice and information from other countries. We saw that in China, in order to stop the spread of the coronavirus, they had to shut some people doors. They have to keep people in their houses. So if people can't abide by simple regulations, for example, suspend services, people are still having services, or stop large crowds, people are still fighting to go to funeral services, people are still fighting to go to weddings. So these things makes fighting any virus very difficult to do. You see, if they have to force the government to go to stringent measures, then stringent measures have to be taken. But right now, we are, like I said yesterday, that we have said certain things. If you know you're not supposed to be having services, why are you doing it? You're not hurting any individual person. These rules were put into place to avoid the direct contact. You never know. The virus doesn't identify you and say, I'm coming to you. The virus is in the air, and anybody could transmit it. So if you are in the service and there's somebody there that is exposed, how would you know? So just stay away from temporary. You can pray at home. You can have a small funeral and then later have a memorial service. So right now, this is the time for you to listen. We are trying, information is out there. Every day you go right outside of this stadium, and you will see people going about their normal don't care business. How else do you get the information to them? Should we start going individually one by one and say, did you hear about coronavirus? please stay away from your friend. I mean, you as a media person is on the air. All radio stations call me 24/7 to get that information out. There's songs, there's other things. What else will we do to inform the Liberian people that Corona is not coming, it's here. And we all need to listen so that we can help each other.
Yeah, go ahead, Minister.
So the critical issue we have now is for us to do effective contact tracing. And for that to happen, we have to utilize some measures that are not utilized during normal times. This pandemic means war. It means that Liberia faces an existential threat. With the capacity of our health system that we know that we're still building to be more resilient. If we allow this virus to spread in a way that I see it progressing, then the entire existence of our nation is threatened. Therefore, we have to use drastic measures. The minister is a medical doctor, and she took an oath, an ethical oath. How do you call it oath? Hippocratic oath. Well, me, I'll take it. So I will call all the people names, and then I will take the responsibility because it will help the contact tracers. So we have John Tier, who is a 72-year-old man who died at ELWA Hospital. We have Doris Prout, a lab technician at Herbert Lab. And we have David Zina, 42-year-old Liberian, who's a lab technician at Aspen. So if people hear the names, they know them, then they will come to us and we'll test them. So those are the new 3 cases. I didn't take a Hippocratic oath, but we have decided for communication purposes and for proper tracing that we'll call the names. And this is not, I want to go further. There's no stigma on Corona. No stigma at all. Watch the international news. Why are we hiding ourselves when you could get treated? There's no stigma.
Then, Minister, let's call the community names.
There's no stigma, but if you call, then you'll be misleading the people, because the fact that somebody worked somewhere or lived somewhere before, then which part of the community I will give the address to. The best thing is what we are doing. This is why I say we'll be meticulous, we'll be ginger, but we will do what is necessary. So there's no need to say Garnersville. So how many persons you find in Garnersville? What other person live there? There's no address system, but if you call the name and the place of work, it will help. So this is why we are doing this. It's unusual, but this is not usual times. It's not normal, but we're not in normal times. It's not the regular way to behave, but we are not in regular times. So I wanted to say before you go to the next question that there's no stigma in this. World leaders who got infected, they came publicly, very regularly, and say, yes, I'm infected, I'm taking treatment, I'm recovering, or I'm not. Public figures. I was just listening to one CNN anchor who got infected. He himself talked about it every day. So don't hide yourself, get treated. So it's not only in Liberia alone that we are naming names. Other people are using other methods, but we need to do it more because of the fact that our systems are different, our systems are wanting, and our systems don't allow us to have a proper addressing mechanism where somebody can give you their address and then you go there and trace the whole neighborhood and follow their pattern. Or some countries now are using the cell phone to track your movement. We don't have those technologies, but what we have is that we are a close-knit society. When you call somebody name, somebody will say, oh yes, I think I know him. Let me see who all he came in contact with. So I'm sorry, but this is what, from a communication standpoint, we decided to do. And I know Doc has her oath and her ethical considerations, but we are in a situation that we have to act in a drastic way.
Well, Doc, on the paper we have one death. We have, so the death occurred. Now, does that erase the number? Now can we say we have 9 cases?
No, you will say number of cases 10.
Okay.
Yes, and then this death, you will put it in the death column. This is how they do it. Number of cases 10.
So it's still 10.
Yes,
okay.
And 1 death. So the 1
no
death.
recoveries.
Yeah, and we had 3 recovery already. The Blama, that first group of people.
When does it become a recovery?
When it's out of the hospital.
When they are ordered, they have been tested and the test result 2 negatives, then they are no longer positive case. But it doesn't really erase the number of cases. Okay. The number of cases will keep going up. There's no erasing. You got 10, you got 11, you got 12, the high will be going. But when it recover, it will go in the recovery slot to say 1 death or recovery 3. Okay, so that's how they name it. But anyway, to say right now, we have been pretty lucky that all of our cases, besides the one guy that died, have all been mild cases. You know, so mild meaning that they did not present with the symptoms that the other people are presenting outside of Liberia, where they need to be on machines and all of that. So far we have had mild cases. So maybe it could be the fact that people are coming a little bit earlier and we're finding the cases. So that's helping. So we hope that people will come earlier. If you have any of those contacts, come so you can be tested. When you test it, there's no specific medication they are going to give you in there. It's based on how you are doing. If you are fine, you don't have any fever or anything, then we're not giving you anything. If you have fever, then you receive medication for fever, or if you have cough, you receive medication for cough. But there's no set medication where they say this is the medication for corona, give it to anybody.
So how many risk contacts do we have? How many people in the observation centers? And I'm sure we have 9 at the 14th Military Hospital.
We probably still have a little bit more at the 14th Military Hospital because I think Blama and them were moved. So the number of confirmed cases have decreased in the center.
Okay.
The suspected cases, there are a few there that need to be tested or waiting for the second test so that they can be removed. The POCs, the place that we're observing people, I think we're down to only 3.
Okay.
And most of them have been tested negative and they are on their way home.
One specific question from Phoebe Hospital. There was a case of a suspected case there. And the specimen was sent to Monrovia, but we haven't heard anything.
But when we said 52 negative cases, the one from Phoebe were included inside.
Let me just say quickly, this is why it's very important to harmonize how we inform the people. Now, the IMS, led by the minister, did not announce any suspected case in Phoebe. Now, but if we can't be reacting to each rumor.
But the hospital management,
which is not the protocol. Okay. And this is why we say you don't announce suspected cases. If there's a suspected case, you go through the protocols, through the chain, and the person gets tested. This is what we don't want. Now somebody is asking what happened to the case in Phoebe when there was actually no case at Phoebe. There was actually no case. The same thing happened in Swajo. There was actually no case in Swajo. So there is continuous testing, and we have asked all of the medical practitioners, when you have a suspected case, when you think that somebody has the symptoms of the virus, you report it. So in reporting that doesn't make it a case until the person is tested positive. So as not to create confusion, this is why we take our time to bring the information to the public, and we avail all of the information to the public. No need for people to speculate, because this is a professional process led by professional people, and we want the pandemic to stop. We want the chain to be broken. So it doesn't help the government to not announce or not tell you the actual update of the situation. But we have to also beware of fake news and of misinformation, because it will create panic, and panic is not something that could contribute to the positive efforts that we're making.
Minister Jala, the 7th case on yesterday, according to the minister, drove himself over to the testing center, SKD. Is that something that people should take advantage of?
Yes, we want people to take advantage. It's faster. You can just go and get tested, and then we'll let you know your result. You know, before it comes out on the air, you will know as the individual who is tested positive. You won't hear your name on the air, you know, which is not fair to you.
Well, Minister Nangbe, you wouldn't be fair to the first 3 cases if you don't announce their names. Do we have their names?
Which first 3 cases?
The ones that made them 6.
But that was done. That was done.
No, I'm not talking about the last 3 now.
That was done, and we did announce it. You see, we are putting Dr. Jala in a position. This is why when I'm alone, I do it. Because we announced, we started with Mr. Blama. We went to Mr. Phillips, who is his house help, and then we went to Madam Ross, first 3. And then I spoke about Mr. Reynolds. Mr. Reynolds.
Okay.
Let me consult my note. Mr. Reynolds, who's the Assistant Minister of Public Works, I myself spoke to him. Some of these people have to understand, they don't mind us calling their names because he's infected, he wants to help to ensure that all of his contacts are tested, and this is why we call the name. The other 2 are connected to Dr. Blama, his security, and his driver. Yeah. We announced their names also.
Okay.
So you should have 10 names by now.
Yes.
Okay. Somebody wants to know what has been done to disinfect ELWA hospital.
All of the places there will be a team sent to using the chlorine spray and everything. They will go down and watch the area where the person was and anywhere else that positive people are.
And also, based on what I've observed and in conversation with the health practitioners, every hospital now, they ask them to do regular disinfection of their premises, whether you have a case or not. In fact, normally hospitals do that, but I think they are doing it more now.
Well, we will wrap up, but let me ask this final question. Is the cases coming in bulk like this, is it overwhelming our public health system?
Well, it's not really overwhelming. We just got to keep, right now we're doing contact tracing and we're doing surveillance. So that team is basically working while the rest of the health system is operating for daily patients who have other things other than corona. So both teams are working simultaneously but yet separately as the contact, because case will go to hospital, case will go to clinics and labs. So once we are able to catch it before it's spread within the facility, then we are doing well in terms of contacting and watching what's going on.
What Minister Nangbe you want to add?
Yeah, just to continue to seek the support of the public to cooperate with the measures. As you can see, the latest 3 cases, health professionals, the 2 technicians. So they are the first point of contact in this war, and they are at risk. So we all have to behave properly, because if you go get sick and you suspect you have the symptoms, and you don't say, you don't go and get tested. This is why we opened this new testing center at the SKD, where you can drive through and get tested. Now, if you don't do that and you go to a health facility, you endanger the health workers, as is the case now with these technicians who are now infected. So this is not a joke. This is serious, and we all have to adapt our social behavior to this new reality. We have to do so, and that is the only way we can break this chain. And I want to use the opportunity to thank our health professionals. They've been working tirelessly, and I mean, you'll be surprised at how hard they work. They are expanding their capacity, the government, they are expanding their capacity to have more contact tracers, new areas for observation centers, new observation centers, and we're also receiving supplies. Just today I saw an email from a group in Europe, the IAEA, that they are sending new medical supplies for us, including respirators. So that's been work on. The government itself is looking around to get more and prepare for what's happening. But our solution is prevention, containment, instead of trying to look towards treatment. But you have to prepare for everything, so it is the cooperation and support of the public that will lead us to win this fight.
Well, Minister Jala, before you give your farewell message, let me first ask, do we have enough testing kits? And how many people are being tested on a daily basis at SKD?
Well, total testing people per day, probably almost up to 100 every day, depending on how many tests we are able to collect. We have about 5 teams out there collecting tests, and so at the SKDA, it depends on how many persons go there.
And the negatives are flowing.
The
negatives or the positive?
Yeah,
you only have one positive.
But at the time we had a 1 positive, there were 52 negatives.
Negative.
Okay.
Okay, so, and test kits, right now, as we stand, we have enough test kits. Test kits are still coming in. It's something that people will keep sending, but for right now, we have enough to test all the people that we need to test.
And already I see a test coming from social media that I said a 17-year-old man died. I didn't say 17, maybe because of the mask.
Yeah.
My voice is muffled.
Right,
It's 72.
Yes, it's
72.
72.
Yes, 72-year-old
Yeah.
person.
Minister, you want to wrap up?
Well, in closing, we'll keep encouraging the Liberian people to pay attention. Try to listen to the correct news and the facts. Stop the debate on whether this virus is true or not true, or whether government looking for money or not looking for money. It's not only in Liberia that this virus is. It's all over the world. So you wake up in the morning, every country is being touched, or some of them have been touched worse. So please, stop the debate, pay attention, try to protect yourself. And I also want to say thank you to the EMS, because they are the one plying the rules to bring people back and forth.
Okay. Well, she's Health Minister Dr. Wilhelmina Jala,
this
and
is
we Information Minister Eugene Lambe. This was a special interview
update.
with them.
My name is Godfrey Beto Kwanzaa.
Coronavirus.
Thank you for your viewership and your comments. My name is Godfrey Beto Kwanzaa. So there you have it. There are 3 other cases, 1 death, so total case is 10, and then 1 death, a 72-year-old man. My name is Godfrey Beto Kwanzaa. For the state broadcast, Liberia Broadcasting System, is bye-bye for now.
In Meriden County, people relaying this broadcast. Radio G, also in Fishtown, River G County, relayed this broadcast. Until then, keep listening to ELBC Radio, State Radio.